Well, within our Voice and Resonance program, we offer gender-affirming voice and communication training for trans and non-binary individuals who are looking to change their voice and communication to have it better align with how they see themselves. We explore different voice and communication targets with our clients. So we might explore things like the pitch of the voice, resonance, which is kind of like tone quality or color, or things like intonation. So we present different targets and work with the client to explore those targets, and then they decide which ones fit for them, and then they choose to practice those and adopt those into the way that they communicate. It's like learning a musical instrument because we're learning to use the voice or the instrument in a different way. So if you imagine if you were starting to learn piano, you wouldn't be playing Mozart on the first day. So it takes practice. We're also trying to change the brain, the pathways in the brain to say, yeah, this is how I communicate now. So the more we practice, the more progress we make. So it can, if people are practicing a lot, it can be a shorter amount of time. But some people do work for months or years to refine the voice to something that they're comfortable with.
I started seeking out this type of support when I was starting my gender transition, but was not yet going through a medical transition. So I was doing what I kind of refer to as a social transition. And so I wasn't on testosterone at that time, and so my voice wasn't going to change in that way. But I was still seeking out some masculinization of my voice, and so somebody in the community had told me that this program existed, so I went on the wait list. And then while I was waiting to receive these services, I ended up starting my medical gender transition. And so I began hormones, and my voice started changing with hormone replacement therapy. And so coming to the program was a lot about stability and making sure that my voice was not feeling really tiring or exhausting through the day, and things like that. And also to just, lower the pitch of my voice to where I kind of felt comfortable at the time. So it started pre-hormones, and then it kind of took off while I was on hormones. When I was having my first appointment and we were talking about how many semitones my voice can use or go to, or what the range of my voice was and the loudness of my voice, and all of those things were really interesting to me, and it made me feel like I had a lot of control over something I didn't think I had a lot of control over beforehand. So it's like the knowledge is power thing, right? That if you know what is going on, you can kind of know how to make changes if needed. And then when I started being able to apply the things I was learning, especially at work, because my job is largely phone-based, and so people aren't seeing me. So being able to play around with the things that I was learning here while I was on the phone at work with people, it was really fun and helpful, and it made me feel confident in myself. My coworkers noticed a difference as well when they would hear me talk in staff meetings and things like that, and it's definitely been a confidence boost.